Welcome to eqcares YouTube channel. My name is Dr. Rachel Goodman. I apologize for the delay. I am having some technical difficulties. This is not my area of strength, working with technology, and it's a new world for all of us. I am a clinical psychologist here at eqcare, and I am now practicing from home full-time. We are ready to help Canadians with their mental health concerns. Just head over to the new eqcare.com for more information. The goal of this question and answer session is to provide suggestions for managing our mental health and wellness as we socially distance or even isolate, which can lead to many challenges to our mental health and well-being. We will not be discussing COVID-19 symptoms, as I am not a physician. We will leave those discussions to the public health officials and medical professionals. We're going to focus on mental well-being today. We've asked our friends, colleagues, and family members to submit questions to us via email at eqcares@eqcare.com. We'll keep taking your questions live. Just post them into the comments section below. So let's get started. All of us are feeling an increased level of anxiety, and you can see I'm a little anxious today because my technology didn't work. And as we said in our last show, this is completely normal. It's a normal response to the situation that we are all experiencing, and we really need to be compassionate with ourselves and with others about what we are feeling and understand that our emotions and our reactions are all within the realm of normal. Today, we will focus on individuals who are isolated due to the COVID-19 pandemic. This is something that is very close to my heart. My mother, who lives in Toronto, is living alone and is completely isolated, although my siblings are, of course, helping her, but she is in her apartment by herself. We're going to talk about this whether you're an adult or an older adult and you're living alone, usually, or if you're currently in quarantine due to travel or due to potential exposure and have had to isolate yourself from your loved ones. I want to send a shout out to my mom, as I mentioned, although ironically, I don't think she's listening because technology is not her strength either. We know from research on the elderly that the presence of social connections and the presence of another person in our lives and in our direct vicinity helps people to live longer, to recover from disease faster, and to experience less pain. Now we are in a very strange position where we are telling people to isolate themselves from other people in order to stay safe. This is the opposite message that we are usually giving to people, and especially to somebody who would be alone. And certain groups of people in isolation, such as the elderly and those who are already dealing with mental health issues, face the potential of having their psychological health especially affected right now. A person's level of activity, how people are thinking, and how people are utilizing their time can all buffer against isolation. We want to talk about some ways that you can help yourself dealing with what we're calling isolation anxiety or perhaps some depressive symptoms as well. Staying physically active is crucial. Ideally, by getting outside, if it's possible, to go for a walk, obviously with keeping a safe distance. If you're walking with somebody or if you're walking alone, making sure you're staying in the appropriate distance from the next person. But if you can't walk outside for whatever reason, whether it's the weather or you're not physically able, then exercising at home. You can do simple things like going up and down stairs. You can be walking around your own home or apartment. If you have an exercise machine, that's a wonderful thing to do. And there are so many free guided exercise routines now online. Feeling connected to others helps to ward off loneliness and stress. And we need to use the term physical rather than social distancing. I had mentioned this on our last show. We are not encouraging social distancing. We want to stay away from people by a physical amount of space, 2 meters or 6 feet, but we do not want to socially disconnect from people. I actually saw an interesting term this week for the first time called distant socialization. We are still encouraging you to connect with family, connect with friends, whether it's online, via email, via text, via social media, and of course, simply by the phone. Right now, there are some holidays that are coming up, Passover, Easter, and it's important that you consider how you are celebrating these holidays. Of course, it's not going to be the same as it is usually for any of us. And this is very stressful for us to think about our family members being alone, or if you are somebody who is alone, for you to think about being alone, that can be very sad and upsetting. So, there are ways for you to join religious gatherings online if you can. Many or Jewish organizations, and I'm sure other organizations are setting up online celebrations of holidays, whether it's exactly on the holiday or in advance, for you to be able to feel a part of that holiday. It's important to share your feelings with others. Instead of saying, we often hear from people who are alone, I don't want to burden that person, whether it's my family member or my friend. They have enough to worry about, especially now. We know that everybody has a lot to worry about, and perhaps we're telling ourselves, and I hear this from my clients all the time, I would talk to somebody, but really they don't want to hear it, or they have too much to worry about themselves. So it's important now for us to remember that we really need to express our feelings if we're feeling lonely, and expressing them out loud to another person. Conversation can help you to feel less alone and less isolated, and you feel more supported by the other person. When you share your emotional pain with another person, this allows you to be validated, and you're able to get the things that are inside your head out to another person, and this can be extremely helpful. You want to reframe your thinking. Many of us are thinking, and especially somebody who is alone, I'm sure, maybe having these thoughts, I am stuck inside, to I can finally focus on my home and myself. If you approach this time with a mindset of feeling trapped or stuck, you will only feel greater stress. If you can take this opportunity to refocus your attention from the external to the internal, what's going on within you and within your own space. If you can think of doing one productive thing per day, that can lead to a more positive attitude. You can set your sights on long avoided tasks, reorganize, or create something you've always wanted to. I do want to mention that there is a lot of feeling that people are having out there, feeling pressured to be productive. And although I did just say, take this as an opportunity to do one productive thing, we're talking about things that can help you to feel productive and busy, but not to feel overwhelmed. Okay. We already mentioned in the last show, but it's worth repeating. Set a routine for yourself. So it's a good idea. Get dressed every day, eat at normal times, set times for work if you are working from home, and of course, time for self-care and time for making social connections, as we said. I read a suggestion that I really liked. It said, stay informed, but fill yourself with love and laughter. Now, most of us, many of us, are watching the news and reading social media much more than we probably should be. And I did say this in the last show, but I'm going to say it again. It's a good idea to choose one news station that you are getting your information from, whether it's online or newspaper or TV or radio, and to limit yourself to that one that you know is a responsible news resource, and to limit it to about 5 minutes a day, or if it needs to be longer, that's fine, but not to be doing it too much. But there are so many funny and lovely things that are coming out online, and you can share that with people. You can share it with family, with friends, whether it's on the phone, whether it's sharing an email, forwarding something. Sorry. To be able to share these funny things. It's okay to make fun of Corona and to laugh about it, and to appreciate kind of how people are getting through this time. Humor releases tension and helps your nervous system not to be in a constant alarm mode. So that's a good strategy to use. I'll say a little bit about kind of your home and taking care of it. Now, obviously, right now, we're all at home, wherever that home may be. And if we're alone, it may seem overwhelming to be taking care of your home, especially if you usually have outside help that comes in to help you, whether that's a family member or a paid person. And I'll just say that, of course, you need to be kind to yourself and understand that we can't necessarily keep our regular routine of perhaps doing laundry or cleaning up after ourselves the way that we normally would. I will say that a chaotic mind can lead to, a chaotic home can lead to a chaotic mind. And because we're living with so much uncertainty outside of our homes, keeping the inside as organized as possible, making it predictable and clean, can help us to feel better about ourselves. It's also a good idea not to eat in bed or work on the sofa if you are working at home. Just as before, keep your routine, eat at the kitchen table, work at your desk. When you loosen these boundaries, this kind of muddles your routine and it can make your day feel very long. Also, a cluttered home can cause you to feel uneasy and claustrophobic in your own environment. So, as best you can, keep it tidy. You might want to consider a new quarantine ritual. Now, this can be something very, very small, like even, taking one moment in the morning or the afternoon or evening to just have a moment of silence with yourself. We talked about mindfulness, doing something like that. You can do something, more elaborate. I saw a beautiful suggestion that a friend of mine had posted about encouraging your kids and yourself to keep a journal or a diary of this time and jotting down the thoughts and feelings that you want to reflect on later and, going back later and reading it. Or you can take a walk every day at the same time or call a family member or FaceTime with them at the same time every day. You can work on a creative project. It doesn't have to be anything elaborate, whether it's just a little bit of sketching or drawing, or pick up a musical instrument that maybe you haven't played in a while. But again, I want to reiterate that you should not feel pressured to be overly productive. And that right now, people are talking about learning new languages and doing construction by themselves in their house and painting bedrooms. And while those things are wonderful, and I really give credit to those people, we should not feel pressured to put that upon ourselves. Right now, with a global pandemic, we have enough to worry about. And the truth is that our attention spans are less available to us because we're living through so much. So you might consider writing a gratitude journal or work on practicing acceptance of yourself. It's also very important to monitor your thoughts and watch out for a tendency to fall into catastrophic or negative thinking. So a lot of times, especially when we're alone, we start to have very upsetting thoughts about being alone, about ourselves, about how long this is going to last. And we want to watch out for that and kind of dial it back to a realistic level of concern and manage those unhelpful apocalyptic scenarios. If your fundamental thought is, I am isolated and I'm in prison and it's a nightmare, then that negative thought leads to many negative emotions. And we know from cognitive behavioral therapy practice that we have to focus on things that are within our control. If instead we can tell ourselves, this is truly unfortunate, but I'm thankful that I'm healthy and that I'm going to do the best that I can given the situation, then we've reframed the same situation and we can understand how that second way of looking at the situation doesn't make us feel as negative. I think a nice idea and a very powerful one is, even if you yourself are alone or isolated, if you can keep an eye on others in need, that can be a helpful distraction to yourself. If you are in a position to support someone else, even by making a phone call and checking in on somebody else, then you give yourself a sense of purpose. And in addition, at the same time, maybe you can create or recreate a new connection for yourself. We talked last time, but I'll reiterate this time about meditation or being mindful. If you find a way to calm yourself through mindfulness and deep breathing for relaxation purposes, in general, this is a good focus for us when we're feeling nervous or anxious or upset, but especially now. I've seen that there are some apps that can guide you through a number of these meditations that can help you to calm yourself. As I mentioned last time, there's so many of them, websites and apps and resources, many of which are being made free right now. Some of the ones that I recommend are Calm, Headspace, Mindful. But I did notice that online, there are a number of online cognitive behavioral therapy programs that are being offered. The Canadian Mental Health Association offers something called Bounce Back, which is delivered over the phone by a coach and is augmented by online videos. And the Anxiety Canada offers something called Mind Shift, which is an app that provides cognitive behavioral therapy support for anxiety with journals and guided meditations. Also, the Center for Addiction and Mental Health and the Anxiety and Depression Association of America offer specific tips for people suffering from anxiety and obsessive compulsive disorder. Finally, if you find that your level of isolation and negative thinking and level of anxiety and perhaps depression are at a level that does not feel normal, and when you talk to other people, you hear that they are not feeling the same way as you are, you can always use telehealth as an option to talk to a professional. As I said, if your anxiety or depressive symptoms become unmanageable. The majority, if not all, therapists right now have moved to online treatment options, and you should reach out for help. You can call your family doctor if you need for a referral. Or you can call your local order of psychologists for recommendations of professionals that can be of help. So now we're going to go to the questions. What is the difference between managing short-term anxiety, day-to-day, versus long-term uncertainty of when this will all go back to normal? So that's a good question. I'm trying to understand what the person who wrote the question is really asking, but I'll say what I think it means, which is short-term anxiety, meaning during the day, I am getting nervous. I am perhaps having some physical symptoms of anxiety. Maybe my heart's racing. Maybe I am, sweating. Maybe I can't catch my breath. I have butterflies in my stomach, and I just notice that I have all of these symptoms of anxiety. So that would be where we would recommend to somebody to use those stress management strategies like a breathing exercise, like mindfulness, like listening to music or doing something else that you know is calming to you. And then long-term, kind of the thoughts, the uncertainty of when this will all go back to normal. It's very reasonable that we're having those thoughts. But again, we have to go back to the sort of cognitive piece, which means the way that you're thinking about things and understanding that we cannot control everything that's happening around us. There's very little right now that we actually can control. So we have to come back to what we can control, which is what's happening in our own day-to-day lives and what can we control in our immediate vicinity, whether it's in your own home, whether you're working, what you can control, and sticking with those thoughts. Just looking to see if there's any more questions that are coming in. Okay. Allison asks, I am working a 70-hour work week due to this pandemic, and I am not moving around enough. Frankly, I don't even notice the time until usually around 6 p.m. What do you suggest I do to help me with taking mini breaks and stretching or moving around throughout the day? Any ideas that don't take a lot of time? Well, I think you said it yourself, Allison, which is it's very important to set those breaks for yourself, if you can, at a routine time. So I would figure out how long I can work without getting nervous or unfocused. And that's different for different people. So I can't tell you how long that is. And then schedule in a short break and put an alarm on your phone or on your computer if you need to, and then go, walk around. Now, if you're able to walk around the block and you have a little bit of time, maybe at lunchtime, that's great. If not, just walk around your home and get your legs moving, do some jumping jacks, do something to get yourself moving, as you said. I do think fresh air makes a huge difference. So if you're in a home and it's not challenging for you, if you're like not in an apartment and have to go up and down the elevator, but you can just step out to the backyard or the front of your house and just get some fresh air. And, like I said before, with the mindfulness, there are very, very short guided meditations. Some of them are 3 minutes. So some people think having to do a meditation exercise is like an hour. It's totally not. Some of these apps have wonderful, very short alternatives, 3 minutes, 5 minutes, 10 minutes, where you can say, I'm going to schedule that for myself. Okay, when I video call my mom sometimes, she often gets frustrated with technology not working. How do I help her from getting too focused and frustrated with the technology problems and instead focus on our conversation? That is a wonderful question. I experienced that myself. I would say, while it's wonderful to actually speak to your mom by video, I'm going to put it out there and say, if it's so frustrating to use the technology, drop the technology and go to the phone. If you can get her on every once in a while, because of course it's important for her to see your face and you to see hers. And if you have children, that's wonderful for her as well, to be able to see them. And then you can FaceTime or whatever technology you're using. But if not, really the important thing is for you to be able to speak and for her to hear your voice and have a proper conversation. Next question. Sometimes I get too caught up in work and don't make time to call my family. How do I encourage them to reach out to me without making it seem like a burden or that I'm not thinking about them? So I would suggest that maybe you book something regular and that you have it like an appointment in your calendar, and that, you make it clear whose responsibility it is. Maybe you take turns, maybe you call them once and they call you once, and that every Tuesday or Thursday, or maybe it's more often than that, if it's every day at a certain time, you're having that phone call. And so you are less likely to get caught up in what you're doing because you've put that little phone call into your calendar, and an alert is going to go off, just like any other alert that you have with your work. Next question. How important is it to get dressed like normal? Sometimes when I dress too comfortably, I don't feel like I'm getting as much accomplished. So I think that's kind of a personal thing. In general, we are hearing recommendations that people get dressed. Staying in your pajamas all day, while kind of cozy when it's a long weekend and regularly you're working so many hours in a row. Now we're kind of in this for a while and we don't know how long it's going to last, but it feels like pretty long already. And it would be a good idea to separate your kind of nighttime routine from your daytime routine. Even if you're wearing nicer sweats and wear something on top that you're getting dressed, at least you feel like you've brushed your hair, maybe you're putting on some makeup, you're getting dressed and you feel more professional. What are some ways to split my work and home life now that everything is at home? So those are tough questions that have to do with your space. But I think that if somebody is lucky enough to have a separate room where they're able to make that their home office, even if it's not officially a home office, whether it's a second bedroom or I know someone who's using a closet, then you are going to have the mindset that that is your workspace. And I would put some things in that space, whether it's your computer, maybe obviously, but some other things that kind of make you feel like this is my workspace. And then don't go into that space when you're not doing work. But at home, if you don't have that kind of space, and it is complicated, you can still try to sort of separate yourself. So maybe you're working at the dining room table, but again, you've kind of cleared it off and made that a more appropriate workspace for yourself. And then the rest of the time, you're not eating at that dining room table, you're eating in your kitchen, perhaps. Okay, moving along with the questions. Thank you, everybody. Should I avoid things like alcohol while we have to be at home? So I think that saying it that way is a bit of a generalization. I think you want to watch your alcohol intake and make sure that you're not using it as a coping skill. I've seen really lovely situations where people are connecting with their coworkers doing happy hour once a week. And I think that's lovely. You're drinking with others, even though you're not in the same space. And, that's just an opportunity for you to socially connect. But if you find that you're drinking by yourself and it's getting excessive and a lot more than you would otherwise, I think that's something that you need to watch. And as we said before, choose an alternate coping skill that can help you to deal with your stress. Okay, family and friends wanting to connect, but when we do, all they talk about is COVID, which drives up my anxiety. Working in health, all I deal with is COVID and I would like to avoid. Any recommendations? So yes, I think that you can have a conversation with your family where you explain to them that you are inundated with this information all the time because of work, and you want to really make sure that you have time to speak to them, and you want to speak to them about things that they're interested in and you're interested in, but can we possibly leave those topics aside because it just increases my anxiety and then it makes it not pleasant for me to be engaging with you? I think that most people, if you ask them that in the appropriate way, would be understanding and would follow suit. With my kids at home, it's tough to keep them inside as much, and I'm not able to tell them when it will be over. What advice do you have to let my kids know that this will be over, even if we don't have the exact date? So that's a tough one. Kids don't understand time in the same way that we do. And when you're younger, I'm not sure what age kids you're talking about, but when you're younger, a few weeks feels like a year and a year feels like a decade. And so it is hard for them. And I think you have to be understanding. And even if they're complaining to you about being frustrated or bored, which I'm hearing a lot at home, we have to try to be understanding that this is really hard on these kids. Even if we know that we're supposed to say to them, they're so lucky that they are alive and healthy, but this is really hard and their whole world has been turned upside down. I do think that the only thing we can tell them is to be encouraging and to say, we trust the public health officials that are taking care of this. And we can see in other countries where this started earlier that it is coming down in terms of the rates, and that some places are going back to normal. And even if we're not going back to normal at the time that we thought we would, this shall pass. And you can give them examples from your own life of things that took a long time and that were challenging and that you got through. And I think that can be a good example. Or you can ask them for examples of things that were difficult for them and how they got through it, and remind them that they do have the ability to get through tough things. Okay, next question. A lot of my friends are able to work at home, but I have to leave to get to work. Sometimes it's frustrating to hear about how they are having difficulties when I'm more at risk out in the world. So I can understand that. I'm especially for somebody who's a healthcare worker who really is risking their lives, or you. I'm not sure what this person does and how much at risk they are, but everybody who's going out there is risking themselves in one way. And firstly, I just want to reiterate how much I appreciate, and we all need to appreciate, all the people who are out there, obviously the frontline healthcare workers, but in addition, the postal worker and the people who are delivering our Amazon packages and the people in the supermarkets. And I have a friend who's a pharmacist who doesn't get to shut her pharmacy, and we owe these people so much appreciation. So We do owe you appreciation that you're going out. Not everybody realizes that because people are inside their own heads. And you might find a way to express that to your friends or family members that, it's kind of hard to hear how hard it is for them. But at the end of the day, as I said at the very beginning, we all have to sort of find a little more patience for everybody and know that each person's situation is difficult for them right now. And that if we can just be kind and compassionate to other people, that's going to help others and ourselves get through. Are there some signs that I can look for in my friends or family that they might be struggling? What are some... Oh, it just got smaller. I lost the question. Okay, moving to the next one. Now that we are not seeing our friends' family, it takes a lot more effort to stay in touch with everyone in my life. How can I manage that while still making sure I have enough downtime? So I think that's true. Some people you want to connect with individually. Your parents, your certain very close friends, maybe somebody you're worried about. And remember that we might not have time to have very long conversations with people right now, but it's really more the connection that you make and showing somebody that you're reaching out to them and caring about them. So if you don't have too much time, you can always text them and just say, hey, I'm checking in on you. Somebody did that to me today. I really appreciated it. But I think that now with the advent of all of this technology and social media, we have ways of interacting with groups of people at the same time. And, if you can create kind of a WhatsApp group or do a Zoom video with several members of your family or friends, then you're seeing all of those people at the same time, and it's taking you less time to do it. Okay, are there some signs I can look for in my friends or family that they might be struggling? What are some things I can do to reach out and really let them know they're not alone? So, yes, remember we were focusing today on people who are alone, and we are really worried about some of these people, and we want to make sure that that everybody who's alone, especially, is doing well. So I think in terms of signs, if you're talking about signs of sort of depression, we might see people who are pulling back, perhaps who are not responding as they normally would to our efforts, maybe not answering the phone or texts as usually they would. You might find people who are having difficulty sleeping, who are expressing sadness, tearfulness, perhaps struggling with increased appetite and weight gain or decreased appetite and weight loss. You might kind of hear signs of hopelessness, feeling helpless, perhaps a change in their self-esteem. And we need to watch out for these signs in people. And when you ask about reaching out and letting them know, I think that's really what it is. Just kind of explaining to this person that you're worried about, I am here for you. And no matter what you say, it doesn't matter. You're not going to scare me. I am here for you, and I will hear whatever it is that you want to say to me. I think also if you feel like you're out of your realm and not able to help that person, then you can give them some resources like we talked about today for reaching out for professional help, or call somebody who is able perhaps to check in on them if you're not able to, and have somebody go and walk and knock on the door. Obviously, we're not going into other people's homes, but if we're really worried about somebody, we can kind of knock on their door and make sure that we're keeping distance and show the person that we're there. We're literally there for them. That is, if you live in the same neighborhood and you're able to do that. Okay, my grandmother is in a retirement home and she's scared. What are some ways I can help reassure her without being unrealistic? So I think that, first of all, although sadly, in these retirement homes right now, a lot of these people are very isolated, even though they're living with so many people in the same building, because they have limited all of the common areas to limit the exposure to one another. So they are feeling quite isolated, but I think you can remind them that they do have professionals who are working in this facility, and the reason why they're isolating them is in order to keep them safe. I think also, and I don't know your grandmother, but I have to imagine that your grandmother has been through quite a lot, like every other older person who I'm finding incredibly inspirational right now. And I've been seeing stories of people who have been through many traumatic events, whether it's a gentleman that I saw who went through the Spanish flu and then who went through World War II and is now going through this. And they're giving out these messages of, we've been through stuff like this and it might be different, but those things were challenging too. And we made it and we bounced back. And you can tell your grandmother, because maybe she forgot, she's, I'm sure, been through big challenges and she's gotten through, and she's an inspiration to you. And perhaps if you say that to her, she'll feel better about herself. So we are just seeing if there are any more questions. We're going to take this opportunity to just kind of summarize and to wrap up. So I think it's important for us to remember we're talking about lots of different things, but the focus of today was in particular about people who are isolated and how we are worried about you and we are looking out for you and we are here for you. And there are things that you can do for yourself to make sure that you are taking care of yourself. And please reach out to other people for help and don't stay quiet. There's no shame in being afraid. There's no shame in feeling alone. But it is a shame on us if we are not reaching out and taking care of you. And just a general statement, we are all responsible for each other. And really, if any of you know anybody who is out there who is living alone, whether it's, as I said, a young person, an older person, somebody who is being quarantined, whatever the reason, we really need to make sure that these people feel that we are here for them. Thank you so much for joining me today on eqcares YouTube channel. Don't forget that members of the EQ community can log in at any time to get mental health guidance during this crisis, or for any reason 24/7 all year in English and en français anywhere in Canada. It's been a pleasure speaking with you today. My name is Dr. Rachel Goodman. Take care.